So we are in the middle of the greatest pandemic in a century. Not since the 1918 flu pandemic have we seen anything quite like this. As Kash said, 3.5 million people have been already identified with the disease. But most of us believe that the actual number of people who've been infected are 10 to 20 times that number. So 50 to 70 million people around the world. About 250,000 people have died. But again, I think that is a substantial underestimate. And most of us believe that the true number of deaths is in the 3 to 10 million range. So this has really been quite a big pandemic already. And we are early. And so some bad news that I have to share, and I'm sorry to do it, is if you think of this as a baseball game with 9 innings, I think we're in the beginning, we're in the top of the 3rd inning. The game has started, but it is early. We have a long way to go. So why do I say that? Well, the bottom line is that this pandemic will continue in the US, in Europe, in India, until we have a vaccine, or until we get to a point where so many people have been infected, 70, 80% of the population, that the virus essentially peters out. But my hope is we don't get to the 70 to 80% infection. My hope is we get to a vaccine. And even under the most optimistic of stories and scenarios, we are likely 12 to 18 months away. So if we think of that 18-month time frame, and we're about month 4, month 5, that's why I say we're sort of in the beginning of the 3rd inning in a 9-inning baseball game. And so what should we expect over the next 12, 18 months? It's going to be a difficult 12 to 18 months. It does not have to be locked down the way we have been right now, but we will see waves of this disease. And we have tools to counter it. Some amount of social distancing, I think, will become the norm and will be the norm for the next 12 to 18 months. We know that testing, tracing, and isolation, that's basically testing people for the infection and tracing their contacts, and then isolating people who are infected is a really effective strategy at keeping the disease burden very low. And if we do that and we maintain some amount of social distancing, I believe we can get through this pandemic, all of us, over the next 12 to 18 months until a vaccine is available. So that's the global picture. So let's talk about what's happening in India. All of you know India has been going through a very challenging couple of months. India has been in a lockdown and has really had 3 phases. The first phase was a 21-day lockdown, which was then extended until May 3rd, until today. And then many of you know, if you've been following the news, that just a couple of days ago, India reported another extension, really creating 3 zones, red, yellow, and green, based on how much disease burden there is, saying some areas can go back to normal, some areas have to remain cautious, and some areas have to remain in lockdown. So what do we know about the state of play of COVID-19 in India? So officially, there are about 42,000 cases of COVID-19 in India, though I again believe that the true number is 10 to 20 times that. By the way, I believe the 10 to 20 times for the US, for Western Europe, for China, there's no reason to think India is going to be different. And that means that in India, 500,000 to 1 million people have been infected. Officially, the number of deaths is 1,400. Again, I suspect that there are many more Indians than that have died of this disease. What's really interesting about India is there have been 2 main strategies that have been adopted by most countries with COVID-19, and India has taken a 3rd strategy altogether. So there was the East Asia strategy, the South Korea, Hong Kong, Taiwan, Singapore, which had testing, tracing, and isolation very aggressive early in the disease, and those societies were able to stay relatively open. The approach of Western Europe and the United States was one of denial in the beginning, acting like it wasn't going to happen, it wasn't going to be a problem, and then when the cases got overwhelming, having to shut down. India, interestingly, took a very proactive approach early. Even when the case numbers were small, India has gone into lockdown. And what that means is that the case numbers in India, while they are rising reasonably slowly. And that gives India time to ramp up and think about what its next steps are going to be. And this is the big challenge, because the moment the lockdowns are fully lifted across the country, we are going to see an increase in the number of cases. We are going to see a resurgence. That is the basic biology of this virus. It may be that we get lucky and in the hot months, it's not so bad, but come the fall in the US, in India, across the world, we're going to see a major resurgence of this virus. So what can India do to get ready for that? And there is really one thing and one thing only, which is it needs to substantially build up its testing platform and get ready to test large scale, millions of people, identify those who've been infected and isolate them. That is going to be a central part, I believe, of a strategy in India to keep the virus from running wild once lockdown has been lifted. So I want to now shift to what has happened over the last 2 months and what the cost of that lockdown has been. And those of us in the public health world who have called for the lockdown and have praised the Indian government's lockdown, I think would be remiss if we did not understand the cost of that lockdown on people, especially the poor. The bottom line is the cost of the lockdown has been massive. And there are some people who have argued that 2 decades of economic gains in India are now at risk. And as Kash suggested in some of his data that he presented, we know that there are 400 million Indians who work in the informal economy. And many of them are at risk of falling further into poverty. Some estimates suggest that 150 million Indians are going to fall into poverty as a result of this lockdown. That is a massive cost. And let's talk about some of those costs, and then let's talk about what brings us here tonight. So obviously the cost of poverty and of impoverishment, especially among the poor, are felt very, very short-term ways, right? We see it in starvation, in illness, in suffering. But I actually believe that the short-term effects are dwarfed by the long-term implications of what we have just gone through. Because what you see and what we know from decades of research and of literature is that when you put nutrition at risk, particularly for kids, there are massive negative effects that are both short and long-term. We see big effects on education. Kids are less likely to go to school. So even when the lockdown ends, starving kids are less likely to go to school. Impoverished parents are less likely to send their kids to school. And less schooling means less education, less learning. These effects tend to be particularly pronounced for girls. And given what we know about the value of educating girls on the long-term well-being of a society, those effects are particularly awful. And that is what we have to fight against. Which brings us to Akshay Patra, but really it brings us to us. The question isn't, in my mind, when is this all going to be over? Because I don't know. I don't know when we are going to have a vaccine. I've said 12 to 18 months, could be 10 months, could be 2 years. I don't know. The question is not when is this going to be over? The question is, how do we get through this? And how do we get through this unified? And how do we get through this in a way that lets us prosper and grow once this pandemic is behind us? For all of us, the next 12 to 18 months are going to be hard. But it is going to be particularly hard for the children and families that Akshay Patra serves. The next year, I believe, is going to be transformative. And there are 2 futures ahead of us. And I want us to think about those 2 futures. And I want us to decide which future we want. The first future is we see these kids falling behind. We see them nutritionally compromised. We see them not being able to go to school, or if they go to school, not being able to learn. We see a decade of gains in gender equity, in economic parity, all of that washed away with one pandemic. That's one future, and we can decide that's the future we're going to live with. But it is not a fated future. It is not fate that that's what has to be. And so I want to talk about a second future, a very different future of what the next 12 to 18 months could look like. We can help these kids and families. We can feed them. We can make sure that we continue to support tying 2 critical needs, nutrition and education. We can maintain their ability to learn. We can make sure that COVID does not rob them of their future. That is our choice. So I want you all this evening to think about what is the most you can do to support these kids? What is the absolute most you can do to support these families? And then I want you to do a little bit more than that. Because while this is going to be a hard year for all of us, we can do so much to help these children and their families get through what I think will be an extraordinarily difficult time. And I can't think of any organization better suited to have that impact than Akshay Patra. How do I explain the massive disconnect between experts and many global leaders, notably in the US, UK, Brazil? Would India have built enough testing capacity coming out of the lockdown? So I believe right now India has not built enough testing capacity. There's been a lot of issues with ramping up testing in India. India's done a pretty good job on testing so far under the conditions of the lockdown. But once the lockdown lifts, India does not have anywhere near testing capacity. If you look at their testing per population, it's really quite low. This has been a bit puzzling to me because India has a lot of biotechnology capacity, a lot of scientific capacity. And so why it has not been able to ramp up testing more on its own is a puzzle. The issues in the US and UK are completely different and mostly represent, in my mind, failure of leadership. But India is a bit puzzling, and we all have to encourage the Indian government and Indian society to continue to drive towards greater testing capacity. I'm hearing from work that we are going to be open. We're going to open all medical offices after May 18th once Governor of Massachusetts lifts the ban. Should Massachusetts open on May 19th? I am very afraid of a second wave coming back. So I don't know that Massachusetts is going to open May 19th. It might. Ultimately, we have to let the data decide. And in here, actually, Massachusetts has been hit quite hard with COVID-19. But I actually think our governor has been very smart and very data-driven about when to open up, how to open up. Obviously, we're only a couple of weeks away from May 19th. I would be surprised if all of Massachusetts opens up by then, but let's take a look at the data. I am also worried about a second wave. And if we open too early, certainly there is a risk of second wave. If we stay closed a little longer and have a good testing strategy, then I believe we can stay open all through the summer and be better prepared for the fall. How important is it to focus on mental health during crisis of this magnitude? What simple things can we do? This is a great question. This is an area that I think has gotten way too little attention. There are massive mental health implications of being locked down, of being shut down. Even for those of us who have not had to worry about going hungry, of course, being isolated is incredibly difficult. So two things. I think first is that we have to put a lot of attention into this as we begin to open up and help people recover. If we find ourselves locked down again, which is possible, I think we have to come up with new strategies for making sure people remain engaged. I often say this is about physical distancing, not social distancing. We have to physically be apart, but does not mean we have to be socially apart. And we have to find ways to spend more time with each other, to engage with each other, virtually and sometimes with some physical distance. But I agree, this is an area that requires a lot of work. Is the idea of contact tracing almost futile at this point, given the spread of this virus? Should we not just be in a mitigation strategy phase? This is a good question. Some people believe this. I don't. First of all, testing and tracing helps in any stage. If you have a very large outbreak, it will not help as much. You won't be able to control it on its own. But I believe as the outbreak gets smaller because of social distancing, testing, tracing, and isolation have to be at the heart of our strategy to make sure we can keep our economy open. If we do not, we are going to have a very, very hard time keeping economic activity going, and we are going to have to shut down again. So I believe we have to keep some amount of physical distancing. I don't believe there are going to be any Red Sox games at Fenway, or not ones that there will be fans going to see this summer. Life will look different for the next 12 to 18 months. But we have to have testing, tracing, and isolation as a really critical part of keeping enough economy going so we can get some semblance of our lives back. How important is privacy when we test, trace, and isolate? Privacy is very important, and I think we're going to have to come up with some very specific rules about how that information is used. In the middle of a public health emergency, I think most people will agree that they're willing to give up a little bit of privacy. They're willing to give up who they spent time with in the last 4 or 5 days in return for a sense that we can have our economy back. If, of course, everybody refuses to give up any privacy, then we're not going to be able to, and we're going to have to shut down again. But I don't think that's necessary. And most of the study says that most people are pretty open and willing to share this information if they know that it's helping their community, their families stay safe. What would you advise Prime Minister Modi to do at this time in terms of reopening the economy and striking the balance between saving lives and saving livelihoods? It's a great question. So as I suggested, the cost of lockdowns, especially in places like India, are massive. They are massive for the poor. And so we have to find a way to keep India open as possible. What I would advise Prime Minister Modi is some amount of social distancing has to be maintained. No large gatherings, no big sporting events, no major religious events that bring hundreds of thousands of people together. Those will fuel big outbreaks, and we can't afford them. So we have to keep some amount of basic social distancing. But of course, this is hard in India, and especially in places where things are very dense. And so what I would recommend is do none of those big events, build in a very rigorous testing program, work on syndromic surveillance. It's a way of trying to monitor how much disease burden there is in the community, and help India's health system take care of people who end up getting sick. If we take those 4 strategies, I believe India can get through this while maintaining its livelihood and without having a lot of suffering from the disease itself. What is your one advice to all attendees about how to stay safe in the current environment? It's a great question, and if one is hard, but I'll try. Think of it this way. We are going to be in a difficult time over the next 12 to 18 months. It's possible we'll make progress on vaccines faster. It's possible we'll have some blockbuster therapies. We've got some progress on therapies happening. Really important for people right now is to use common sense, maintain a certain amount of social distance. If you can avoid it, don't hug your friends. Don't hug people randomly. Wash your hands. I know these things sound really simplistic, but I actually think that's really important to do. I also believe that there is emerging evidence that if we all wear masks in public, face masks, cloth masks, etc., we can keep the burden of disease down. And so we may end up in a situation where for large parts of the next 6 to 12 months, we're going to be wearing masks in public. It's not going to be super comfortable, but I think it may be one of the things that help. But personal hygiene, washing hands, don't touching your face, maintaining a modest amount of social distance, really, really important to keeping yourself healthy. And in the fall, when the flu vaccine becomes available, get the flu vaccine so there's no confusion about getting the flu when the COVID virus comes back again in the fall. Thank you all again for inviting me this evening, and please remember the great work that Akshay Patra is doing in helping kids and families in India. Thank you.